to go through this information. And again, if you have any questions, just stop me along the way to try and help you as we're proceeding here. So a few of the objectives, again, this is the educator in me. So we're going to review a few things. Savannah wanted me to kind of go over, I know a few of you may be questioning like the medical side versus the nursing side. So we're going to get into kind of the nuts and bolts of what that looks like. And then I'm going to discuss the education and role of kind of the steps of the nurses. So a lot of people say, well, what's a CNA? So we're going to talk about what a CNA is, and then the different areas, education and role that's associated with an LPN and an RN degree. And then, of course, I'm going to answer some of your questions and go through what Savannah wanted me to go through as far as some interview questions. So let's get started. So first up is kind of the difference between medical versus nursing. And so I know a lot of people, and me being one of them, I went into the University of Missouri as a pre-med major, as a matter of fact. So I thought, I'm going to go into medicine. I want to be a physician. And actually, it was there that I went and job shadowed a physician and found that I liked the nursing side. I liked to be around those nurses that were caring for the individuals. They were taking time with those individuals and the clients, knew a lot more background on those clients and patients than the physicians. And I learned that I really wanted to be in tune with those patients. And so that's where I saw nursing as that opportunity. So kind of a brief overview of what medical versus nursing looks like. I commonly describe it as a person who is admitted for a swollen foot, right? A physician is going to look for the cause and effect of that swollen foot. So a lot of times they're going to do an x-ray. They're going to do very scientific pieces to figure out what exactly is causing that swollen foot. For the nurse is actually the hub of everything that's going to impact that client or patient. So not only are we going to be talking to the physician about that cause and effect, but we're also going to be talking about potential nutrition of that client, labs that could be needed for that client, possible therapies or exercises that could be utilized for that client. So we're looking at kind of the big picture, the holistic approach. And a lot of times you will hear your physician say, well, I have to talk to the nurse, because the nurse is the hub that kind of interweaves and interconnects all of those disciplines together. As you see here, scientific medical is based off of the scientific knowledge that they've got in front of them. Nursing also bases a lot of our knowledge off of that same scientific content that that medical side is getting. However, you will see nursing add a lot of holistic caring. We focus a lot on what we call curative factors. And that means we take, again, the entire body into this picture. So we're looking at what is the client dealing with psychosocial? What are they thinking about? Are they stressed? Are they anxious? Are they concerned about certain things? We're going to have those discussions with them. And we're going to focus not only on the scientific piece, but we're going to bring that into that holistic care that we're going to provide that client. Again, the medical side is time completing research and investigation is really kind of a focus for them. And time for us is spent bedside, caring for the client, really getting to know our clients very, very well. Specialties for the medical side, usually there's about 20 to 60 specialties that are education specific. So you'll learn that if you're going into medicine, you go to medical school, but then you do residency in your particular specific area, and then you hone in on that specific specialty. So you don't see many cardiologists, right, then saying, hey, today I'm going to be a neurologist today. That's not something that they can just easily switch in and out of. However, for nurses, we have an abundance of specialties. However, we're all trained in what we call general nursing care, which means that we could be working on a med-surg unit and be caring for a client there. But then because of our nursing skills, we could be pulled over to the OB department to care for a client who has just had a baby, just taking vital signs, caring for that client. So we could work within different specialty areas without actually being trained specifically in those areas. Now, that being said, there are specialties and certifications that you can gain in those particular areas. But what my what I'm trying to make you mindful of is that medicine does have to kind of make a decision. Nursing, if you get into a certain area of nursing that you don't particularly care for, you can switch that a few years in or a few months in and tell your supervisor, hey, I want to go to maybe ER and look at that area. So that's a possibility. Now, with the medical degree, as you all know, there is education. Again, there's 6 to 8 year programs. It depends on what type of medical school you choose or that the person chooses. And again, then they do residency on top of that. And again, depending on their specialty area is how long their residency is. So again, for neurologists, surgeons, sometimes they will have 6 to 8 year residencies. So obviously their salary is going to compensate them for that education. And so what we're looking at in the state of Missouri, average physician who is out of school is making about $250,000 a year in the state. For education for the nurses, again, the education for the medical side, 6 to 14 years total, right? For the nursing side, you can actually be a nurse in a couple years after graduating high school. So I've actually had a nursing student who graduated from one of my first programs as an associate degree nurse at the age of 19. She was a nurse working in the field as an RN, and she was coming out making about $50,000 a year. Now, granted, that extends a little bit. So you're going to see with years of service, again, that education is 2 year to 4 to 6 years, depending on your master's degree. And you're looking at making, again, with an RN, 55 to 70,000 in the state of Missouri. So again, we'll kind of get into more of those tracks here in just a second, but that kind of gives you an overarching view of those differences within those tracks. I'm going to pause there for just a second. Is there any questions over just these two particular models that you had a question about before we move on? Okay, seeing none, I'm going to move on to the different tracks for nursing. So now I'm going to get a little bit more nursing specific. So the certified nurse's assistant, a lot of those programs are integrated either one in a tech school, like within high schools, or they are provided by a long-term care facility. Again, these are training programs, usually a few months long, to train someone to care for an individual. Again, they're certified, they take a certification exam, and they're a nurse's assistant. So they do a lot of taking vital signs, just caring for those individuals, really taking care of their daily modalities. For the LPN, that LPN is going to require you to apply to a nursing program. So an LPN program is usually provided now by community colleges, and they do maybe a 1-year LPN program. So within 9 to 12 months, a person can graduate with their practical nursing degree and then set for the licensure of a licensed practical nurse. In the state of Missouri, they usually make about $30,000 to $40,000 if they're working in acute care settings. If they're in long-term care settings, it just kind of depends on where they're working and how long they've been working for. But for LPNs, they range right around $30,000 to $40,000. The next step in the process, a lot of LPN programs will then have another step to their process, and that's called the associate degree in nursing. That's the 2-year program. So that at the end of that completion, another 9 months on top of your LPN training, or 2 years for an associate degree in nursing. After those 2-year time frames, those particular people will go out and take their licensure exam as a registered nurse, the same licensure exam that you will take if you graduate from a bachelor's degree. The RN NCLEX exam, the national certification or licensure exam, is the same for an associate degree nurse that graduates with it versus a BSN that graduates with it. So upon that time, they'll take their licensure exam. Upon passing, they will be declared an RN in the state of Missouri. Again, that's where they usually start out around that $50,000 mark on average. Again, they can excel towards higher as they move up those chains and lines of command. The RN to BSN program is through a traditional nursing program. So if you were to go to a university, typically, and say, I'm going to a nursing program at a university, that's typically what you're referring to, a BSN, a bachelor's degree in nursing. That program is usually 4 years. 2 years is your general education requirements, first 2 years, just like any other college that you would go to. And then the last 2 years are your nursing courses. You then graduate with your bachelor's degree in nursing. You take the same licensure exam as that associate degree nurse. It just took you 4 years, that person 4 years versus the 2-year associate degree. So it's kind of dependent on what your goals are as to which track you choose. And I'll give you some of the pros and cons of why you would choose an associate degree versus a bachelor's degree. So again, like I mentioned, the associate degree time, it can be a pro, right? You're done in potentially 2 years. You're a registered nurse. You're going out and you're working in the field. Within working in that field, a lot of Missouri hospitals will then pay for you to complete your RN to BSN, which is something that Northwest does, where I currently am employed. We do it all online for those registered nurses who are wanting to come back and earn their bachelor's degree. And many of their employers will pay for them to advance their education because they want them to be educated to be able to serve those clients best at the bedside. So 1, it's time. 2 is money. Community colleges for the associate degree are typically less cost than a 4-year bachelor's degree program. So you're going to come in with less debt typically, and that employer is going to pay for you to proceed with your education, and you're going to be working as a full-time nurse during that time. So you're going to be able to pay as you go potentially as well, or reap some of that debt that you had already accumulated from maybe the community college and be paying that off as you continue your education. What people tell us is that the differentiation between RN and the BSN graduate is that it takes approximately 3 to 4 years before you start to see that differentiation in what we call career ladder. So for the associate degree student, they do need to have in their mind that they're going to continue to their bachelor's degree within 3 to 4 years if they don't want to see a difference in pay compared to that bachelor's degree nurse. And so again, career ladder means that you're advancing, like in leadership, things like that, that are then going to advance your employer status, but also your salary there. So again, that's something to be mindful of. For the person who's wanting to get done the quickest and money is not a concern, then obviously the RN to BS or the RN BSN degree, where you're going straight into a university setting, doing your 2 years and completing your 2 years of nursing program, then that could be a potential option as well. There's pros to that as far as getting done and not having any more education to complete in that 3 to 4 year time frame, like the associate degree nurse. However, with the con with that is more debt and a little bit more time, a 2 year more time frame added on than the associate degree nurse. Then lastly, again, after you complete those, you'll hear a lot about different degrees that you can progress into. Our profession right now states that we want 80% of nurses at a bachelor's degree or higher. They set that for the year 2020, and we did not make that goal. So they'll continue to progress our profession to keep us gaining in those degrees. They also want nurses to continue to advance in their master's degrees and doctoral degrees. And so with that, there's different options, as you may have heard. So the master's degree in nursing, again, there's various specialties that you can go into with that. A few really hot areas of master's degree right now is the nurse educator, nurse executive, and nursing informatics. Those are some key hot master's degrees that are really being seen by our profession and are needed by our profession. If you've heard of the statement nurse practitioner, that's where maybe the DMP will come in. Right now, I will say, Savannah and I just mentioned this in a meeting the other day about the nurse practitioners are really oversaturated in our area. So again, by the time you complete nursing programs, I would just say do your research when you complete that bachelor's degree to see if you're wanting to progress in your education, see which route is going to really be able to give back to you in your profession. Right now, that's an oversaturation. So we're really needing those 3 that I mentioned, those hot topic areas that I mentioned. Right now, DMPs, which is the Doctorate of Nurse Practitioner, are, again, options to progress in your clinical area. And then there's also PhDs in nursing, which is more of a research-based, education-based format. So again, progressing in your education there. Any initial questions over this particular slide that I can help answer?
So if I went to Mizzou, would that be the type of like where I don't really, the cost isn't as much of a difference, like it wouldn't make a difference and I can just get it done? Would Mizzou be that kind of place?
So Mizzou will be increased costs. So community colleges are lower cost. So you'll get your bachelor's degree in the 4 years, but it would be, again, I think right now they're looking at $30,000 to $50,000 for those. Again, I would do my homework as to which one you're choosing, but for the most part, you're going to have money issues. The tuition is going to be very costly for those 4 years, but you'll be done in 4 years with your bachelor's. So it's dependent on the time, if the time's the factor or if money's the factor. That's kind of what you need to weigh. Does that make sense?
Yeah.
Okay. Good question.
I have a question too. So you were talking about how if you have your associates in nursing to try and get your bachelor's in 3 to 4 years, is there a timeline for that with your master's that you would recommend?
Really for masters, it's not something that's a push for our profession unless you are wanting to go in to like nursing education or a particular CNO like leadership position over a lot of nurses. The master's is really not a requirement at this point. Again, I always tell people if you're interested at all in doing that, proceed with that, because it's not something that you want to kind of take a break but you have to have that area of specialty that you're kind of wanting to go into by the time you reach to the master's. So that's where you need to make sure that you're pretty sure on which direction you want to go, if that makes sense. Good question.
Thank you.
Okay, so I think I got a question from Benjamin. Hello, which nursing field is in the most demand in the States? Well, that's a great question. Honestly, every single, we have a huge nursing shortage right now. So I'm actually going to answer that here and on the next slide. So that was a perfect, like, it's like I asked Benjamin to ask that question. That's awesome. Okay, so you'll see my last quote here. So AACN was the American Association of Nurses. Staff nurses make up the largest number of hospital employees in Missouri. This year's report finds a staff nurse vacancy of 12%. Staff nurse turnover increased 2%. It's the highest it's been in a 20-year history. So 18.1% currently is what we're needing in just Missouri. So across the nation, we're continuously seeing a huge nursing shortage with that. And I also mentioned the Missouri Hospital Association report here. And I will send these references to, I think Savannah actually already has it, but she can send you out this. And if you ever question what are needed or what are some current professions in the state of Missouri in healthcare that are of high demand, that's where you would definitely want to look and see. Right now, again, registered nurses outweighing all of them. It's one of the #1 things that you're going to see outside of a CNA. So those certified nurse assistants are very much needed as well in our profession and within the state. So yeah, perfect. So one of the things is nursing right for you. I think this is such an important question to answer as you continue to kind of think about, there's so many options in the medical field. And I think it's fantastic that you have so many options in health occupations. Really reflect on why you want to be a nurse, if that's kind of the direction you want to go. And the same thing with medicine, any of the medical field, really reflect on why you're wanting to do it. It is not an easy profession. However, it is a very fulfilling profession because you're continuously seeing people hopefully get better and you're caring for them and you're seeing how you're caring. That caring component can really change everything about their outlook, their family's outlook. It's very much an important piece to reflect on. Why you would like to do the work is very, very important. because there are so many definite areas of nursing available to you. So think about that. One, I also wanted to highlight, we are the most honest profession. We've been that for, I think it's like going on an insane number of years that we have been ranked the most honest profession among all professions in the nation. And so just think about that. You have to be a very honest, forthright person. You have to be willing to do the job and to work for your clients and be honest with your clients throughout that. So that's something that we really as a profession advocate for and uphold as well. Again, as I mentioned, it's very high demand. So you're not going to get out with this degree and have problems finding a job. You may not have the job you automatically want. You are going to likely have to work some nights and weekends and some holidays out of the gate. But I will say that, again, you have to take that for what it's worth. You know, there are a lot of people graduating from college right now with professions that they cannot, with degrees that they can't get a job in. And that's not the issue for these particular healthcare professions. And then, of course, again, ultimately, it's all about the caring, but also knowing that the money is very good. It's very good income for what you do. You're compensated for that. And so that also helps because we don't want to negate the fact that everybody's having to survive. So again, working hard, you get to paid for what you work. And that's important as well. I also mentioned here the job shadow. So look for some AHEC opportunities, reach out to Savannah or her team at AHEC and really look for some of those. I know they've opened some of those back up to allow students back in to do some job shadow experiences. And that's really where I learned through some of those job shadow opportunities exactly kind of what that profession meant and how to grow into that profession and if I really was cut out for what that nurse was doing. And so take advantage of those opportunities as well. And then I think that's all of what I had left. So I'll just kind of open it up for any other questions or any, interview questions that you had, Savannah, if you wanted to ask any of those.
All right. We do have one question from one of our students. How do we know what major to choose if we are interested in nursing?
Perfect. So yeah, so that would be typically where you're going to choose a university or community college that has a nursing program. So you should have a nursing major within that. So you should be able to choose a nursing major. If the university or community college does not have that, then I would look at other options because truly you're going to waste some time probably. The one thing that I would tell you is like Northwest, for instance, I'm going to give you an example. Northwest doesn't have a traditional 4-year program. The option for our students when they come in pre-nursing is that they take the 2 years of general education requirements that are required for any bachelor's degree in the state. They complete those and then they go to a community college for those 2 years. So essentially they're completing their 4 years that they would at any other 4-year BSN institution, but they're going to then come back and complete their bachelor's only 9 nursing courses after they get done with that associate degree. So it's kind of, again, you have to question what they have and really look out for those nursing particular majors. You want a nursing major.
All right, thank you. And you can always reach out to our office if you're confused if a school has a nursing program or not. Yes. Definitely something that you should talk about if you are going on college visits. Make sure that the colleges you visit have a nursing program. And again, if you need help with that, we can always help out. Yeah. So I'm going to start off with our interview saying, what classes did you or should these students be taking in high school and undergrad to prepare for a career in nursing?
Yeah, great question. Obviously for nursing, it's science, lots of science. So anatomy and physiology are great courses to get into in either high school or for college credit, if you can find something that does it for dual credit, or even a community college where you can take that before you get into nursing programs. it's ideal to have some of those sciences under your belt. Math is another one. We don't do, again, I know math scares a lot of people when I say that, but we do a lot of dosage calculations, and you learn a lot of that in your nursing courses. But algebra is kind of helpful in kind of understanding how to set up a ratio proportion look and how to configure those particular medication administration routes. So that's something just keep in mind. But yeah, I would say science and math highlighted are the key ones to focus on.
Okay. And then since they can't really work on a lot of the technical skills in high school, what are some of the soft skills that they can be kind of conscious of and working on in high school to kind of prepare for that career as well?
Yeah, that's a great question. So that is something that's overlooked a lot, but nursing is soft skills, as I just mentioned. So it's a lot of communication, clear communication, and focusing on how to speak to someone. So that is a huge thing with nurses coming out right now. We have to be very mindful of how we communicate with not only the patient, but their family. You're going to have to answer questions. And so really it's that oral communication that I would highlight as a very needed trait and soft skill that you'll need to perfect before getting out. Again, a lot of times they're teaching that through nursing school. So I will say we focus on a lot of that through nursing school. But I would say that's one of the #1 soft skills that you need to focus on. I think I am getting some other questions here, Savannah, if you want me to read those as well.
Yeah, absolutely.
Okay, so I think Benjamin asked, medical doctor, like a nurse becoming a medical doctor, or do they need to go back to school to attain that doctorate degree? Great question. So for them to go back and become a medical doctor, they would then need to go out and actually go to a medical school. However, a doctorate in nursing practice is what we kind of, again, they become doctorates in nursing practice. And within the state of Missouri, they are working underneath a physician, but they are doing a lot of physician type, they have a position. So they're providing prescriptions, they're doing their own assessments, and they're ordering their own labs. So a lot of what we think about as far as care for that client from a physician perspective, the doctors of nurse practitioners can then do, but they are kind of overseen within our state. There's a lot of legislature out right now looking at whether DNPs should be kind of pulled into their own category outside of overseeing the medical professionals. So again, that's something up for debate, not anything that probably will be seen in the next few years, but just so you're aware, that is something that as nurses, you can move towards that particular area of education and really kind of mimic that same care that's provided as a DNP. If that makes sense. Okay, so Katie, she wants to become a labor delivery nurse. I love that. Would it be smarter to go to Trenton and use my A+ hours and get my classes done than go to a nursing program, or just go to Missouri Western and do all 4 years there? That is a fantastic question. So I would say again to weigh your pros and cons. And so one thing that I will say is A+ obviously is going to help immensely with that debt factor. And in CMC, I would also look at those programs, Missouri Western and in CMC's, their pass rate. So remember when I mentioned the NCLEX pass rate, those nursing schools have to, you graduate and then you have to all pass the same licensure exam. The pass rate of those institutions should be a key factor in that. So I would encourage you to look at both of those programs and compare that as well. And then also knowing that Trenton at NCMC, you'll be done in 2 years versus 4 years of completion. And remember, if you were to complete at Trenton, let's say, and then you go to work for a hospital or healthcare system, they will then pay for you to go back and get your bachelor's. However, that will take maybe 3 to 4, 4 to 5 years, depending on how quick you do that after getting your associate degree. Missouri Western, if you go through their 4-year program, you're going to be completed with their bachelor's in 4 years. So you'll be a bachelor's degree nurse. However, it's likely that you will have more debt with a 4-year program, no matter if it's Missouri Western or any 4-year program. So It's really dependent on what your goals are there. So I would say either way, they're both great programs, but I would weigh the pros and cons as to that, if that makes sense. And then Isabella says, what should I be doing now in high school to prepare for job shadowing and nursing classes at home research? Again, really good question. High school really, again, like I mentioned to Savannah, focusing on those science courses is going to be big. For your job shadow, I would really encourage you to do a couple different specialty areas, right? So as I mentioned, I thought I was going to be a peds nurse until I got into OB clinical. And then I was like, yeah, I don't. And then I did peds clinical and figured out I had wanted nothing to do with those children. I wanted babies and mamas. So that was just, again, that's insight on what you see right out in the field. I wouldn't have known that until I got to follow those nurses and really see what their day was like every single day. So I would say that I would pick a few different specialties that you're interested in and see if you can pick up some job shadows for that. Honestly, as far as preparation, I would say just go in with an open mind. I would not say that you have to study anything, that you have to look anything up. Go in with an open mind, really take in all the things that the nurse is doing during the day and see if that interests you. If you leave there and you think, wow, this is not at all what I thought it was going to be, this is not good, then definitely I would say maybe we need to focus on a different area. So how would I become a pharmacist, or would that not? Yeah, that's a totally different specialty area, Jenny. So again, that would be something that you could look up as far as anywhere that offers a pharmaceutical school. So there's some specific pharmacy schools. I'm sure Savannah has some outlets with that or can help direct you guys in that. But again, that's not something that we particularly do within. We pass a lot of medication from the pharmacists and nursing, but we don't major in that area. Good questions, guys. Okay.
So kind of to go off of, so we talked about the differences between physicians and like nurse practitioners, but what would be the difference between working as a nurse practitioner and working as a physician assistant in Missouri?
Oh, okay, good question. So nurse practitioners, again, in the state of Missouri, medical assist or the physician's assistants are making a little bit of leeway. I will say that physician's assistants have it's taken them a long time to get to start building up, because they were in Columbia when I was there as an undergrad, and they have not really grown much in our area until recently. I've started hearing more and more about them. For a physician's assistant, again, they are the right-hand person to that physician. So a lot of times it is those specialty specific physicians that a physician assistant is helping. So let's say they're following a neurologist, they're taking down notes, they're making sure that that particular client is cared for, they're doing rounds on that client. That particular physician is kind of giving them the reins with their patients, but they're reporting back to the physician because it is their particular patient. As a nurse practitioner, even though she or he is overseen by a physician, it is still the nurse practitioner's clients. So they are caring for those clients. They are making decisions based off of their clients. The physicians that oversee kind of or sign off on their care are really there as maybe that person that can help collaborate with them. They call them actually collaborative physicians. So it's something that they can collaborate and ask questions of, but they're still their patients. But the physician's assistant is caring for that physician's patients, if that makes sense. Does that help answer that?
Yes, actually, that helps answer that a lot. That's been a question we've been looking through a lot recently. So thank you.
Yeah.
So kind of to pick on your educator hat, what are nursing schools looking for out of applicants? Like, what do these students need to have on their resumes and on their applications?
Yeah, so I will say there is no, unfortunately, that's one of the things that is kind of a pet peeve in nursing education right now is there is nothing, no number that tells us that you're going to be successful in nursing school. we all make these requirements. So you've all heard it. It's in every university or program. You have to have a certain GPA. You have to have a certain ACT or entry test. And all of those things are important. And most nursing programs do have some stipulation on, they want your GPA to be at a certain level. They want your ACT or a prep test. So a lot of times nursing programs will pick their own test, an entry exam that will look at, maybe your science or your math score. So those factors that we talked about previously, they're really going to hone in on. But one thing I can tell you is, if you have great scores, that's great. If you don't have great scores, don't let that deter you, because truly in nursing and in the medical profession, it is about grit and determination. So if you are determined to be a nurse or be in the medical field, the GPA and the overall, overall situation that you're in high school is not necessarily going to be the framework for what you're going to be at in college. So continue to work hard to show that you are determined to meet that goal. That's going to be the key point in nursing and truly any healthcare profession. So we all have those guidelines that we have to set by, but really don't take that as, oh, I'm at the, I've got to meet this by the minimum. Really take that as an opportunity to continue to meet that grit and determination to build yourself up.
Yeah, and I think honestly, that grit and determination is going to be important way after you're done with nursing school anyway. I mean, getting
100%.
into and getting through nursing school can be a challenge, but what are some other challenges that are kind of seen within the field of nursing that they should be looking out for?
Yeah, so I mean, obviously with us dealing with COVID in the last 2 years, you guys know some of the challenges that we've faced as a nursing profession with that. I would say one of the things that we as a profession did not do a good job at acknowledging ahead of time, but are really working on that right now, is self-care of our nurses, and really making sure when you're caring for others, typically the last thing that you care for is yourself. So when you dedicate your whole entire life to caring for everyone else, you got to make sure that you're taking time out for self-care. And so I personally know that your generation, the generation that we're currently seeing come up, is really good about taking the needed self-care and to take time for that. And truly, that can be an advantage we're learning, honestly. We've talked about that in generations. We are really not doing well as, the Gen Xers, millennials are having trouble adjusting to some of that self-care initiative. So we're hoping that generations coming up are going to help us understand how important that is. So I would say really having mindfulness of that and being able to really reflect on your self-care is going to be huge in this profession, ongoing.
And I really like that you mentioned that self-care, because I mean, obviously within nursing, you are going to see a lot of traumatic events.
Yes.
And taking that time for self-care is really important.
Yes.
What are some of the traumatic events that you can experience in nursing that you kind of would want to be aware of so that you can take that self-care time?
Yeah, I mean, obviously when you're dealing with lives, then it's, there's a lot of trauma there that can occur. You're dealing with people who have been put in situations that you cannot fathom. Some of the stories that I've heard, it's not even at a nightmare level. Like, you just can't even imagine that anything like that is happening to anyone. So there's a lot of times that you're going to hear things that you didn't think were even possible. Obviously, you're dealing with death of family members. Some of the most traumatic events that people will ever go through in their life, good and bad, will occur with a nurse typically standing by their side if they're in the hospital or in a long-term care facility. So most generally, you're the one that is kind of going to take in all of that. I was taught very early that you almost have to, you're doing your job, but you have to make sure that you're talking through it, that you're sharing that insight. Again, we are bound by confidentiality. We can't go out and tell everybody what we saw and who we saw, but you can share how you're struggling. And so that's going to be important. Again, you're going to hear and see a lot of things that you may not ever think that you would see or want to see. But it's important to share that information with others, reflect and really lean on your nursing professionals to help you through that, and healthcare professionals that have seen that and how they dealt with it. Again, we're good at sharing and helping each other through those times. A lot of times when we're faced with traumatic events, we have what we call debriefing with one another. And so we will come together after a traumatic event and talk it through and really talk about what went right, what went wrong, and how we could approach that the next time. So it's an important aspect of our profession. We take it very seriously. Yeah.
Right. And I think we have time for a few more questions. So if anyone has questions that they want to ask, if you could put that in the chat. But I have another question for you, and that is, what is a common misconception about nursing?
Oh gosh. That's a great question.
I think it's a fun one.
What would you say?
I think it's a fun one.
Yeah, it is a fun one. That, I mean, I would say, gosh, I've heard so many, honestly. Probably one, I've heard, it's kind of like, oh, all you do is sit at the desk and kind of check in on patient. It's not much to your day. That's definitely not true. I think just like with any profession, there are days that are better than others. And so some days, we feel like we can catch a breath. Other days you feel like 12 hours has passed in 5 minutes. So I would say that is something that's fairly common. I would say the reason that we do it is for the money is a huge misconception. It could be the reason that people go to nursing school and become nurses, but I guarantee it's not the reason that people continue to be nurses. So if that is the case out of the gate, if that's the reason a person is going into it, like first and foremost, I'm going into it to make good, decent salary, good money, it's not going to be enough to sustain them through that profession, because it's just not, that won't be enough. You have to really have that caring capacity in that field. So I would say those two probably are those good ones. I don't know.
And that's a very good segue into our job shadow commercial. So I'm going to share, because we have a few questions about job shadowing. So if you want to job shadow, you can job shadow at Mosaic Life Care. You can job shadow in Maryville, Albany, or St. Joe. So no limit on where you can shadow. You can shadow in any department or any specialty. So if you want to shadow in labor and delivery, you're more than welcome to. We do have some requirements. First requirement being that you need to be at least 16 years of age. You have to have at least 4 to 8 hours available to shadow. We highly recommend that you have these days during weekdays. That's typically when clinics are open. And then you'll have to fill out some paperwork. So we have some job shadow guidelines you have to read. If you are needing job shadowing for a class or anything, or to apply to nursing school or medical school, you can fill out this form and we'll keep a transcript. Then we have some forms that you have to fill out. And then after that, you can request and we'll start to schedule that shadow for you and get in communication with you after that is done. Okay. Oh, we do have one more question. Someone is asking how much money would they save if they went to nursing school through A+ than if they were to go to a probably like Missouri Western's Bsn program?
Yeah, that's a great question. Unfortunately, not one that I can probably answer specifically. So each tuition, each bachelor's degree education is going to be completely different on tuition. So it's going to be a little drastic. Same with community college and the A+ allocation. Some universities will give a scholarship for the A+ monies. So they may get a little bit out of the tuition. Again, you remember that it's a 4-year a 4-year commitment to go to the bachelor's degree at like Missouri Western or any of those nursing schools versus the community college that you'd have 2 years. So you weigh the, the A+ money or scholarship could be there for the first few years, but then not be there when you hit nursing school. You just have to do your homework and research on how much would carry over and how that stipulation would go. But that's different for every single college and university out there. Yeah. Good question.
And when you are doing this research, make sure that you're looking at the health profession school tuition, because that is going to be different than just the standard undergrad tuition. So you can't just look at Missouri Western's website and look at whatever the cost per credit hour is. You'd have to look at the cost per credit hour in the nursing school.
Great point. Yes, correct.
But I think A+ is a really good option if you are interested in nursing, because essentially if you can do some dual credit classes, do some AP courses, you can most likely get your RN for free. And then like Brooke mentioned, a lot of hospitals will pay for you to do the BSN bridge. So you could really like kind of kickstart your education for free. And then once you decide to do the master's program or the doctoral programs, then you won't have to worry about paying off your undergrad loans.
Right. And some institutions will pay for you depending on what, what you're doing to continue your master's and PhD or DMP. So it's depending on, what route they're looking for, or if they're needing nurse leaders, then they're willing to pay for that as well. So you could essentially come out very, very well if you take the correct tracks and can look into that. And if it works for you. Yeah.
Yeah. And I think it's also like really neat that nursing is a field that you don't have to have all of your education done in order to work in the field. You do not have to have everything done. You can kind of do your education throughout time and have a job and still be making money as you go to school.
Yes, that's a good point too. Yeah, I have a lot of students who are taking one course every semester, and they'll be doing their bachelor's for, 5 years. I have others that can be done with their bachelor's in 9 months because they're taking a couple classes at a time. So it's really based off of, again, how quick they want to get done and what their goals are. Yeah.
All right. Does anyone have any other questions? All right, so we're going to stop this share screen. And I'm going to launch a poll for you guys. If you wouldn't mind completing this poll, when we're done with the poll, then you guys are good to leave. If you have any questions, you can hang back and Brooke and I will be able to help answer your questions. It's been great having you guys here tonight. We will have our next health career chat in December. We're going to be skipping November because we're having a workshop in Maryville. So if you're interested in careers in physical or occupational therapy, get in touch with me and I can give you more information about that workshop. If not, our December health career chat will be about careers in healthcare that you can get in 4 years or less. So if you are kind of in the spirit of not going to school for your entire life, we would hope that you join that one. But here's the poll. You guys have some time to fill out the poll and continue to ask questions in the chat or unmute yourself and ask questions out loud. These last 10 minutes are your guys's.